And the numbers are still increasing slowly. Okay, let's give it. Let's wait until 7:32, and then we can start. Okay. Okay, it's 7:32, and let us start. So good morning, everyone. Welcome again to this edition of Data at Breakfast. And this morning we are really very fortunate to have Dr. Vukosi Marivate with us. Vukosi is the APSA Chair of Data Science at the University of Pretoria, and he's been working on machine learning and artificial intelligence methods to extract insights from data. And in recent times, he's been very active in extracting information about the COVID-19 coronavirus situation in South Africa. Yeah? He's mainly interested in data science for social impact, and using the local challenges as a springboard for research. Yeah? He has worked on many projects in science, energy, public safety, and utilities. Among other things, he founded the Deep Learning Indaba, which is the largest machine learning workshop school on the African continent, and which plays a huge role in educating our young researchers in this area. Yeah? In recent times, as I indicated, he took a leading role in collecting all possible and accessible data about the spread of the COVID-19 virus, of the coronavirus, and make it accessible openly in GitHub. Yeah? And that I think is a mammoth task that we are all very, very grateful for, Vukosi. So thank you very much for that. Without your dashboard, we wouldn't be able to do almost anything. So thank you so much for setting that up. Yeah. So in Vukosi this morning, we'll speak about the use of available data to inform the COVID-19 outbreak in South Africa, a case study. Yeah. So Vukosi, thank you very much again for being with us this morning. And we are very much looking for your talk. And before you start, or while you start sharing your screen, let me remind the audience to please use the question and answer facility, which is on the right-hand side at the bottom of your screen. And after the presentation, Anban Pillai, who is a computer scientist at UKZN, will monitor and the questions and pose them to Vukosi so that he doesn't have to be too busy during his talk. Yeah. So Vukosi, thank you very much. Please go ahead with your presentation.
Okay, thank you for inviting me on this morning. I'm looking forward to presenting, but mostly looking forward to the questions at the end, because we learn from these experiences a lot. I'm just going to share my screen. On there. Okay, I think we look like we're going to be okay. Okay. All right. Hopefully you can see my screen now.
It's perfect. Thank you very much.
Can you just confirm?
Yeah,
okay,
it's
cool.
Perfect. Thank you very much.
Okay. Yes. All right. So my talk this morning is going to be on kind of one, it's a paper. So we have a paper out called Use of Available Data to Inform the COVID-19 Outbreak. But you will see it's mostly documenting kind of the project and also where we want to go. On there, it's not just my work. I think that's the thing that I've had to learn, a lot at this time. There are very many people who have been contributing on this. I think at the moment on GitHub, officially, we had like 43 or so contributors, but it's more than 60 volunteers who've been working. So even the picture that I'm showing at the bottom here on the front slide is actually not representative of the kind of the overall amount of man hours that have gone into this. So I'm at the University of Pretoria. I am the principal investigator for this group called Data Science for Social Impact. What we try to do in this research group is we work between these two pieces of work, where one is data science and society, where the COVID project kind of falls in very nicely. That's about 40%, I think, of the students or group members are working in that space. And the other 60% is mostly natural language processing and machine learning. So we have many projects and collaborations around these spaces that we're trying to now improve a lot of actually local language tools for machine learning, and then making it available internationally, kind of in a way. So getting to really what we hear about today is like, COVID-19 ZA, which is the name of the project that we started, or why did we kind of start this. So South Africa started testing early for kind of COVID-19. This is end of Jan, early Feb on there. We started getting all these briefings from the Minister of Health, and these briefings started getting very detailed. So then there was this explosion of cases, and there's also this kind of need of more information. So what happened is that, okay, funnily enough, I was down in Durban for a conference, and while I was there, this is the week I think we started before we basically got into, hey, we're going to go do a lockdown. There was these questions from some of the group members. We have this monthly meeting of saying, what is it that we are going to do to try and assist in this space? At the beginning, I'm like, I have a visiting affiliation with the CSIR, so I work with at the CSIR 1 day a week as well, and there I've been seeing what had been like, been building up, interacting with DSI as well, and there was this push of like, oh, people are like, building models, we're building models, and we then looked at it and said, okay, but what is it that we can put our energy into that likely kind of can make the most impact in more the medium to long term? And as such, then the idea came about of saying, we've got these statements that are coming from the minister. How do we make sure that they're available, all the data that is in there from these official sources is made available in a machine readable format? And at that time, it was, we're not going to do any modeling. All we're going to do is focus on the data. On a way. If you want to kind of understand the modeling, there's work that's going on at CRISPR at UKZN, there's work that's Sakima, that's UJ Hero, and then there's also UCT, and people who really have spent a lot of time trying to understand epidemics and all those things. So we're not going to kind of go into that space. Let's just look at the data for now on there. So the needs, we wanted to make sure the data is in one place. It must be collated. It must be kind of verifiable, that you can go check where it come from. We want to find ways to reduce the chances of error. I'll talk a little bit about this. And then how can we prepare a foundation for other researchers and innovators to build on, right? So the reason you also want to make data easily available in machine readable format is people can literally just do a URL get and then download the data and use it. And make sure that we work to make this open from the beginning, right? Right. The what and how, we came up basically with a simple pipeline on there. So you're going to see a public release that comes from government on COVID-19 cases. So at the beginning it was mostly the minister. Then you had the premiers. Then you have the MECs that are releasing, the Ministries of Health releasing data. So those are official sources. So we did not take numbers from, we don't take numbers from, oh, this news website said this, or somebody made a statement outside, like, a government official on that. So we are not doing that at the moment. Any additional information that is shared around those cases is then hunted down, and then also put in. We then look at these kind of, this then tends to mean that it comes from different platforms on there, convert it into machine readable format. There's some validation. We reference the source of the information, and then it gets kind of pushed into the repository. And people then can obviously then go in and take those pieces of data. Initial approach, you had these statements that you could get from the minister, and what we wanted to do was convert them into these nice CSV spreadsheets. For example, this meant that we were going to, given that there were daily updates, we had to update daily. We wanted to automate as much of it as possible. and leave space for validation, and then get feedback as well. This was very important because we do not know everything in this space. We don't understand some of the local situations in different parts of the country. So we want to always have a way for people to give us feedback, raise issues, or in terms of, hey, here's a bug, here's a a place where there's a mistake, and those things can actually get fixed over time. I think this week there's been like a very big heated debate about what the column headings are for one of the provinces, and this is exactly why we wanted to make sure that there's feedback so that there can be these discussions, and by the time we make an agreement, it's at least the best informed that we have at that time on there. One of the things that we did at the beginning is that we did automate some of these. So one of the volunteers built a scraper that would read the NICD website, or read the SA coronavirus website, or read the government website, and automatically create the CSVs on there. But very quickly, kind of this changed because the minister stopped actually giving information. I think for the initial cases and what the age, the gender, and the mode really of likely infection, all of this was about only for the first 300 cases, and then after that the minister stopped. The same thing has happened with deaths. Only for the first 100 cases or so we had the individual line lists, as in epidemiology, where you have some information about that. But we did have scrapers. Those scrapers still exist. So if it does come back, it's easy to then work and fix that. So the one thing was to make the data repo open by default. This meant a little bit at the beginning also having to have a conversation with our research office at the University of Pretoria about how to best do this. And it was then kind of came to, hey, we're going to make the data available under Creative Commons share alike and attribution license so that people can use it. We want people to be using this data so that they can assist other people in making decisions about different things. That's the whole point of our research group on there. And on default, the code that is being built by everybody, the volunteers, in the repo is also under the MIT license on there. So that's kind of the general description. In the repo, you can find a lot of different pieces of data. There is information that's available on the cases, the deaths, the recoveries, the testing, all of those things. There's the data down to district and sub-district level for most of the country right now. I think as of this morning, a volunteer submitted Northwest data now. We had been collecting it, but we didn't have a person who had adopted the Northwest. So today in the morning, I got an email just before this call, and now it's actually being pushed in. So that data you can get in this district data. And that's kind of one of the most active places because people are trying to now piece together what has happened over the last 3 months in every district and every sub-district on there. You also have some health information, health systems information, which will go in there. And and then there's some data that's deprecated, meaning we can't update it anymore at all. One is the confirmed cases, which was updated to this. These are confirmed individual cases, so each patient anonymously on there. And then the deaths information was in the same way. So that's also being deprecated. It's still usable for people who want to do some other analysis. There have been people who have been trying to understand the mode of people, how the virus might have come into the country, where it might have come from. You can get that in the confirmed cases. Then there's some other information about the deaths themselves, which we hope this will be opened up. I think people on this call, if you do have an opportunity to, sway some decision makers, having especially open line lists for both the deaths and for the confirmed cases would be great. I'll talk a little bit about that later. And for people who then using this data set, it's just, there's people who then, if you're using it in your own visualizations, there's just you just cite it in a way. If you're then people are writing academic papers, it's explaining how the data itself was collected is a journal article that we've written and got published. And then there's also, this gets updated a lot. The data is available on Zenodo, so it is archived. That's again the big part of this, that we're trying to make it sure it will be available 10 years from now for people to continue understanding what has happened during this period. As I said, we want feedback, so there's an active GitHub issues page. So for those who don't know, in GitHub, in issues, it's basically almost like the discussion board. So if you see something that's wrong, you can create an issue and then say, hey, describe the issue. If you have an idea, you put it up there and then think. So you can see for one of the examples there is, hey, there's a feature or enhancement that we want for people to adopt a provincial testing sheet. Can you then give us information about your province, about testing on there? Because this is one of the challenges that we've had in public, that the testing information is not updated in a regular manner. It's great to have that overall number for the country, but what's actually happening in every province is very important. We also have these, another issue here on, we have these NICD weekly reports now that are being published. What information is in there, and then can that be digitized into machine readable format? So that's still requiring somebody to adopt that. And yeah, when there's errors, people bring that up. So you can see here there's a wrong missing keys in district, and then people bring that up. Right, we do then also have an API. So there's some people who just want to build an application on top of the data, and they only want specific endpoints. We make it easy that you don't need to deal with the CSV. We had a volunteer, Vukosi Marivate, who then built an API, and I think there is a second API which we should actually document that somebody else also built that also reads from the repository, and all of these are openly available for people to use on there. Right now we're thinking, especially for the initial API, to try and get some small funding just to pay for a Heroku premium, costs to cover a year, so that we can make it faster on there. So those those are some of the small things that need to be funded, but the volunteers have worked in, and we're also working to assist some of the volunteers to apply for small grants. We have volunteers who are freelance developers who would put in more hours if they could just have a stipend for a couple of months. So we also encourage people to apply, and we work with them to actually apply for those grants on there. So all of this then comes to I've taken most of this time to explain the data, because that's most of the work. 80% of the work is actually doing that work, that work of collecting data, cleaning it, and making sure it's available. And just to show then what's possible when you do this, then we build this dashboard. And the dashboard is it's just that. It's just, we're showing okay, now that we've got all this data, we can show what's actually possible on the other side, on actually going and building a repository on there. So this was version 3 of the dashboard that we built. It has a lot of information that's in there, and it's also one of those experiments of how do you deal with visualization. I teach visualization in our Masters in Data Science program at University of Pretoria. So then you go in and say, how do you show information, make sure it's not overwhelming. We also have discussions there. There were early on discussions about how do we make sure that people don't panic when we put information out. And then we also then have parts of it that are experimental. So I'll show a little bit of the dashboard for everyone. Let me see. I'm just going to enter full screen for a little bit. Yeah, so this is the dashboard as it stands today. Everything has been updated as of midnight when the GitHub changes came in, because the data came in late yesterday on there. So we do show some information, and it's always evolving. So if you had come in 2 months ago, here it would have been, in terms of the positive cases, what the ages are. This is about to go out very soon, just because the minister has stopped providing that information, so it became stale. The rest of them are staying on there, so you can get positive cases, recoveries, deaths, how many people in ICU. This is now getting maybe 4 days late, so we don't have any more. This is the only reason we wait to get this information is that the president, when on Tuesday, the president on Sunday, when he was announcing the change to lockdown level 3, he actually announced this number in there, but the minister hasn't. You have the total amount of positive cases, the recoveries, the deaths. You can get the dailies, and then you can also see a breakdown by province and the total tests per day and things. So that's the main kind of page. If you go to a provincial page, which is something that's still experimental, and I know has been in some cases some people feeling that they don't like it, was we just adjusted the number of cases per 1,000 in every province, giving estimates of the provincial sizes, and you can now kind of compare each of the provinces given these adjustments on there, but then you can still also get the raw numbers for each of the provinces. Again, because we've worked to make the data open, you've then had other people come along and innovate on top of that. So we have a student at UCT who then takes this data and then maps it. So if you go to this provincial map or regional map, what you're seeing there is not something we've built, but something that one of the volunteers has built, and it's automated. It reads from other, and then it will give you a breakdown per province, and then you can also choose to see by municipality, and then also go down to districts through that. So then if you further go on and say, I'm actually interested only in one province, we've activated most. We're still having some challenges getting KZN. Mpumalanga is coming along. I think that should be open up very soon. So you will be able to see this probably by the end of the weekend in Mpumalanga. Northern Cape is still kind of a challenge, but you can see most of the provinces now available. When we switch them on, it means that we have kind of the district and sub-district information, and that's available on there. So if you look at Gauteng here, you can go in and look at Ekurhuleni, Johannesburg, Tshwane, the different districts that are in there. And another thing that we do have for Gauteng and the Western Cape for now is that we show this number that we do calculate every night, which is the real-time reproduction rate for for the whole country, for every province, for every sub-district that we have information on. It automatically gets calculated and it gets put into the repo. Again, it's mostly, there are other researchers who would like this information, so they can pull from the repo and get that number actually adjusted. So you can see, for example, here, with the reproduction rate, you want to be under 1 to feel like you're controlling the spread. But we had the situation in Gauteng in the West Rand here, where they had, I think, 150 cases testing positive in one day because of a mine outbreak. And you can see that the reproduction rate then jump up given this. And now we're monitoring, if actually that was just a blip, or there's going to be actually issues that are caused by the spread given that. And you can see the same thing in the Western Cape that has been, we've been actually monitoring on there, where the Western Cape has had this very high growth for a while, and you can see that they had over 1.5, a reproduction over 1.5. It's then started slowing down, but we're trying to kind of get that on. It's a heuristic, it's not an absolute. We don't read these numbers in absolutes. It's a heuristic of saying, is it a way for us to understand actually what is going on that part? So that's the dashboard. It's being used, we know, by a lot of people, but that's just one of the outputs in this space. Just continuing to continue and finish this off. All right. We also use the WhatsApp from the Department of Health, which was created by Pricelt, where they publish, you can just say, on the number, say cases, and we'll give you this response. And this also gets put into the repository, and it's updated as much as is possible. So you can go back and actually see the WhatsApp messages that are available in the repo. The repo itself, just to finish off before I move to things that I think are probably a little bit more interesting. Sorry, I'm trying to move a thing. Okay, there we go. That's the repo as it looks like. As we said, there's a lot of information that's in there. We try to describe as much of the information, and we know we have one of the issues that's open now is just to do some cleanup on there. We also kind of highlight some of the things that people have built on top of this, and we do know, on the other side, there's also research that's being done with the data that's in there. So you can go on one part, and say, okay, I want to look at data, and you will see a load of data that's in there. You can just read the readmes and then try to, for the data that you're looking for, you can then find. as an example, I said that there's the WhatsApp messages, so you can see them, they're right here, all updated up to 27th on there, and you can use that if you need them for something on there. The cases, for example, these are the daily provincial breakdowns all the way down to the 28th, which was yesterday, and these keep on being updated by different volunteers. So to try and now finish off, so we then built up this real-time reproduction rate that's using a Bayesian approach, and it's adapted from Kevin Systrom, who interestingly is one of the co-founders of Instagram. There's also an MCMC version of it, so you can get it if you want to actually volunteer and get it ready and test it. You can make it available for other people on there. The other thing that's going on now is we put together the pieces to allow for a model hub, so that different research groups from across the country or can submit their model that they're using for forecasting in a kind of consistent way, use the data that's available in our repo, and then predict for, like, a week ahead, a month ahead. And then these can actually be compared and contrasted by other researchers. It's very important because obviously each model has different variables that it takes into account, different assumptions that it's making. So we're trying to now make it available, like that people can actually have a place that they can put their code. It runs, we actually automate that running, and then there's a visualization that's built up that allows people to actually compare and contrast. And this is inspired by this same type of hub that is created by the University of Massachusetts in the USA. So, like, as I said at the beginning, we weren't doing any modeling for a reason, but now we're seeing that there's there could be some positive for us just allowing for this interactive way to compare and contrast, and also then open up an issue and have discussions about these models in a way that is very scientific in a way. So you can go to the website. I'll put the link to the slides at the end of my talk. Showcases, there's been a lot. I've shown the map with the district maps, that goes in. Initially it was just for the Western Cape, but now it's for the whole country. There's a testing site information that uses official testing sites that have been put up. One of the volunteers also then translated this website, which is built in Switzerland, into isiZulu so that people can actually kind of use it, not just in English on there. We've had the dashboard also translated into Xitsonga, and people are welcome to translate. Again, you can use the data and derive as many things as you want on there. So it's available in Xitsonga. I know there was a question about also translating into Chivenda, and we're hoping that will happen soon. We also have people like media houses using the data for their own things like dashboards or their stories as they're building up, so that they can provide kind of up-to-date information as it's required. What's next? One of the big things is the capacity and capability of the health system in South Africa. Very early on, a couple of the volunteers came together around this, and we found that data was very outdated on where the hospitals are in the country, whether they're public or private, what capacity and capabilities that they had. So they worked to create this version 1 of this data set, which is all the health facilities in the country with as much information as possible. And it took a lot of things. So, okay, I didn't update this, but you can actually get this already. We have a blog post on our group website that explains how this data was actually kind of created, all the challenges that came in, and we it meant digging up people's PhD thesis, but we did. And from there, you can look at a hospital, understand which district it's from, how many beds are there, with the latest information that we have, what cluster it belongs to, and now we have a volunteer who's updating all the websites of all the hospitals as much as possible, so that in a week, hopefully we'll all be in there. As I said, there was this map that was created then of all the testing sites from this health systems information we are collecting. And we're hoping to get to a point very soon where we can do a simple triage of every hospital, meaning that if now we can start getting an updated piece of information on how many ICU beds are being used, how many high care beds are being used, the general bed availability of every hospital in the country, we can even build a visualization that's like this, that comes from Germany, where Germany has had for more than 2 years this open health triage for every hospital in Germany, where you can go on a map, click on it, and it will tell you whether it's red, orange, or green in terms of that hospital's capacity at that moment. And this is very important, as now we're going towards the peak of the epidemic in South Africa. You need, you know, for a lot of health workers, they need to be able to make decisions kind of very quickly. I've talked about the model hub. As I said, that's available and people can actually go in there. And right now, which are trying to finish off the first paper this weekend, because we have a paper deadline on Monday for a language conference, is we've now gotten ethical clearance to do work on looking at social media on coronavirus in South Africa, and also working with Media Monitoring Africa to also look at traditional media on there. That will be work that should be available probably in a month. So we're doing a lot of analysis. We're trying to understand kind of what the public had been more concerned about, what the interactions between government and the public have been, and what's actually kind of worked very well and what's still kind of missing on that part. Recommendations: we can't do modeling without good data. Public data should be public. We ideally do not want to be doing this work or actually collecting data from the government. Government should be making it available very easily on a portal. And we should also work together on that. There is, sorry, yeah, again, should update these slides. We've had a lot of work now from some of the modeling teams. That we have a weekly modeling seminar hosted by Pravesh Deva from the CSR, and people have really been showing what they've been working on. It's very nice. And we need to get ahead of things like this very early. We wouldn't be able to do what we've done currently if we hadn't started when actually it was early days, because the amount of man hours it takes to update is ridiculous. And also at the same time, we need to figure out what is it that we don't know on there. The challenge also is that data is political. I do get, like, you know, a lot of emails with people either making suggestions. They're very happy and they're showing us also what they're using the information for. But then also once in a while, you get these emails that are people not being happy because some number is being shown. Why is this number being shown? It should be removed. And it doesn't make any sense for us on that part. And some of it also, the data that's, like, you know, the way it's not being availed in an open manner is because there's these challenges of people being very worried that they might be exposed on there. But this shouldn't be. We're in a pandemic, and we shouldn't be making decisions kind of in that way. We should be trying to make as much data open as possible so that people can use it to make decisions locally in a way. And an example I use is this case in Florida where a scientist was fired because they were refusing to change numbers so that they would back up Florida's decision to open up on there. So this is just for data scientists and machine learning people and other like statisticians out there that, yes, like, you know, we can't keep on assuming that no, the data that's being made available is not through a political process. It is through the kind of these processes. So we should be careful in different ways. Public institutions should have procedures to work with those outside. So going back to the question, like, you know, some question of we haven't had as deep data from every province, and some of it is because there's just not capacity to be able to do that locally in a way. I am working with the Gauteng Premier's office, so I'm seconded there, and I have one of the volunteers and my PhD student, Hercules Combrink, he's seconded to the Department of Health in the Free State, right? So we're working from the inside, but then we would like also to have access to more people on there. And health systems also do need better ways to work. And as I said, all the data is available on Zenodo. We are updating it probably every 2 weeks just so that it's archived. We also have the same thing for almost the whole African continent, which is line lists that are available. And I think we're having a meeting on Monday just to look at where we're going to go kind of next. So yeah, in citations, there's a paper that's out with the same title of my talk. And then the data set also itself is citable. Thanks for this. I didn't want this for my talk to be too long, so I tried to keep it to 30 minutes so that we can have then Q&A for most of the rest of the time. And thanks to all the volunteers. As I said, there's way more than just the ones that I'm showing here. I think we're close to over 60 at the moment, and it does continue because we like sometimes it's also building tools for people to be able to volunteer. But there's some people who are not comfortable with Git or have never used it, so we're trying to find other ways to make them be able to contribute towards the project. So thanks, Francesco, and UKZN also for inviting me.
Thank you very much, Vukosi, for the very, very informative and interesting talk, and in particular for all the hard work that you've been done to give us access to this data and for being a strong proponent of open data and open science. That's very important to all of us, and it's one of the basic missions of our data at breakfast, to make data open and freely accessible. I will, before I ask Anban Pillai to pose the questions of the audience to Vukosi, I quickly want to introduce to you also Professor Tullio de Oliveira, who joined us a few minutes after we started. Tullio is in our medical school. He's the director of CRISP, and maybe we will ask him to ask a few questions to Vukosi as well after Anban has addressed the questions of the audience. So Anban, please, if you would be kind enough to summarize the question that the audience posed.
Thanks. Thank you, Francesco. I think we'll start with the availability of data. And there are a few issues around that. The first question is from Sean Garnett, who was concerned about why has the Department of Health not been more forthcoming with the data. So as you suggested, that it would have been nice if we had a portal that was curated by Department of Health. So that's the one question around that. Why is that not happening? And the second question is that some of the COVID task team advisors are from UKZN, and whether or not we have reached out to them to get the data that we need. So maybe we just talk around the difficult issue as to why is it so difficult to get data.
One part is, given that I had I've been at the CSR for a long period of time. I'm now only part-time, but I've been there since 2015 back when I finished my PhD and came back to South Africa. Through that, the opportunity that I got in working in the CSR was to work a lot in public systems. So how do you bring things like machine learning into public systems? And you learn that it's an interaction between people, systems, and the thing that you want. Right. So in this case, if the data is the thing that we want, but then we also have people. So do we have capacity? Do we have capability? And what's, unfortunately, the political situation in a space? What's the risks that people are thinking about? And then, like, you know, at the end, is these systems, do you actually have the technical systems to allow these kind of things? So in this case, it's almost like in some ways a perfect storm. You have NICD, you have individual labs, you have the NDOH, you have provinces, you have all those things. So now it's kind of like you're having these multiple systems that have to talk to each other in a very streamlined way. And that's going to take a while to get to a point where they are kind of settled on there. So it is great that the minister gives a update. But then, like, you know, if one part is, if we can do it via GitHub, why can't NDOH just create their own GitHub? And then just make it available through that, right? And then people can also assist in doing that. I think with John, thanks John for the question and also volunteering on there. We had, I think at some of the beginning, some of the Western Cape people who are building their dashboard come along on our GitHub and then either ask questions or make suggestions. And that's a great way to do this. And I'm not saying that the Western Cape is perfect, kind of in a way on this part, but that's a way that you can actually tap into the talent that is out there. And this is very important maybe to highlight because of having a slowdown and a lockdown, there's a lot of technical capability in the country where people are like, I don't mind taking 20 to 30 minutes a day just assisting and answering questions or suggesting fixes to technical things. And this has been a call through my work with some of the provinces to say, let us know what your problem is, describe it in a way maybe that's general, not specific to a case, and let people try to suggest fixes or even submit code that can assist you internally in resolving kind of these issues that you're having technically. So I think this crisis has highlighted that we can't go back to this, right? If we are in the same situation 2 years from now, then this crisis in terms of this specific topic would have been a waste. The UKZN one, I guess you'll answer on that side.
Okay.
Or maybe we can ask Tullio to briefly comment on the KZN data availability.
Yes, good morning. Yeah, and congratulations for the great resource. Yeah, yeah. Francesco will tell you that we use that almost every day. Yeah, and just before I comment in UKZN, just to comment on two little things. I think that you guys have done a fantastic job, and it's even better that this GitHub and this work is done outside the Department of Health, because it is, I find very important that they are releasing the data public and that's being analyzed independent. I think that it is much more powerful than if they were locking all the data and doing their own analysis. So congratulations for the Pretoria team to put that together and to help everyone on this. Yeah. In relationship to the question about UKZN, yeah, yes, we do use your data a lot, and we also use not only your data, but we also use a lot of analysis from Francesco and from Eli. Eli is also on the call, yeah. And what we do, it is a little bit different, yeah. We decided not to do dashboard because we thought that you guys are doing such a great job on that, yeah. And normally what we do, it is like to answer questions very quick that the chair of the Ministerial Advisory Committee has. That's Professor Islim Abdul Karim, yeah. And we even have a joke between Francesco and I. We call him the commander-in-chief. And then when he asks a question, we send a red alert, yeah. And the reason for that, it is because a lot of times it come different questions, yeah. A lot of the questions, and that's from the minister to Professor Abdul Karim, they are doing a lot of analysis. They have a very high number and very competent statisticians, yeah. But sometimes they also ask questions for us. And a lot of the question that he asked for us, a lot of time, is to compare different countries, yeah. So you probably have seen a lot of the graphics that Eli and the big data and Maria generate in the media, even used by the minister when we compare that about the UK. We also compare that with countries like putting in the same day of the epidemic, so understanding number of cases and testings and testing coverage, yeah. So what we do is to respond to questions, yeah, and then a lot of time we use your data, yeah, to answer the question that they have.
Thank you, Tulio. Anban,
Yes.
were there more questions from the audience?
Yes, there are. I think we'll move on to the data itself. The first question we had was, how do you deal with underreporting, latency, and the validity of the data? So maybe that's the first question we should look at. A related question is, can you put error bars on the basic reproduction rate? And has there been a consideration to include flags for jumps in the data? Example, the mine outbreak. So that's just related to the data itself.
Okay, thanks for those questions. The error bars, yes, thanks for pointing that out. The data itself, the raw data actually has that 95th percentile. So you can get that. It's just kind of playing around with it on the dashboard software. We will do that. As I said, like it's being, at the moment, it's just being trialed in terms of making it available for only Gauteng in Western Cape, and I'll work to adjust that. And then once it's ready, it will then roll out for every province and the country with the error bars kind of on there. Data sourcing. So yes, just like Tulio talked about, like, you know, what happens when the decision makers around you ask questions and then you have to go in and dig deep into data. So because of working with the Gauteng province and working in the Premier's office, there are these questions that come up. So we look at the data. So there's data that is on the GitHub that's available for everybody. And there's obviously data that comes in from Gauteng that I do sometimes get to see. And then there's these questions that come up on like the differences either between national and provincial data sometimes, and we do investigate those as much as we can, possibly. But at the moment, we don't have a good way outside that. For us, is just to make the data available. I remember a case right at the beginning where the minister put out 2 statements in a row, and there was a ghost case that was either in UKZN or Western Cape, and it couldn't be resolved. We didn't know if that case was in KZN or it was in Western Cape. And those were the nice days, because it was just one line where we are like, oh, this person, it says they travel, but we don't know if they're actually based in KZN or Western Cape. Now it's almost impossible. And what we started noticing, for example, we ask sometimes if we do have access to people. So for Gauteng, what you would have noted now is that if they have a delta, like sometimes you have a case yesterday was 55 in a specific district, and today it's 53. So the question that comes up naturally is, wait, how did 2 people stop being positive cases? So Gauteng in their statements now makes notes at the end of the statement explaining why there might have been a difference over there. In national, it's harder. I haven't seen from the minister for a while trying to explain something that's kind of it was classified as being in in Gauteng, but actually this person lives in the Western Cape, so we changed it from a Gauteng number to a Western Cape number. So these changes, even those ones, I'm not even getting into the point where it might be a testing error or things like that. They are very hard at the moment to really get to fix it. If there is a suggestion on a way to kind of deal with these things, it'll be great. Like one way, sure, could be an errata file that just goes in per type of thing, of just saying, here's what an error might have been on this day, and here's how it was actually fixed by a national government or provincial government. But at the moment, it is a very tough task. So yeah, if somebody can go open up the issue, and if they have a suggestion and might want to actually volunteer or adopt chasing these errors, it would be great.
Okay, thank you. So the next set of questions deal with the use of the data itself. I think you've answered the issue of examples of research projects that the data repo is being used in. But if you want to just re-look at that, the next question is, what sort of decisions do you hope this data will inform? And is anyone looking at projections at national and possibly district level?
So I'll give an example of just something that came in earlier. So I talked a little bit about the Western situation. So that's been a big discussion in Gauteng now. So we were able to go and look and like, you know, they use the dashboard. I know also at the National Command Council, they've said that they're also using the dashboard. They're also looking at it in a way, and then they're also now, they're reading the data, which is again very odd. It's like government itself should be making the data available, but they're also consuming it and using it for their own kind of systems that are required for these type of things. So the Western situation has, I think, brought a lot of questions of saying, okay, fine, you have a mine, the mine tests and 150 tests come back positive. But then now it's now going to go in and say, okay, now we need to check the growth in Gauteng after we know that there's been this jump of 150, because we know there's going to be knock-on effects, right, on that part. So that's a thing now that's being monitored. So it's already kind of, it's assisting us in, we're checking what's actually going on a daily basis given those 150s. Internally, what this should be bringing up is now tracking and tracing people who might have come into contact with those 150. And also, remember, with the mines, a lot of the employees they might have gone home and were coming back. So the sources of the infections might not be actually at the mine itself. So it now brings up a lot of these questions of saying, okay, which then sections are connected with where these cases are coming from. We're hoping to have something in public that is going to be kind of discussing that, just like at UKZN, the very nice report on what happened at St. Augustine, right? The nice report, like, it's unfortunate that that situation happened, but then doing that playback is very important because it's getting us to understand where the weaknesses might be. It's small things add to very, very big consequences in these spaces, and that's where we're hoping the data and ends up being useful for. And then we've seen it in some of these spaces where people then come in and say, okay, we were able to look at that, and can you please help us find why this is actually happening in this place. And as I like, in terms of research, there is a lot of research that's being done. There's a couple of papers that we've seen now that people are using it. They're building forecasting models. As I said with forecasting, all the way down, if you want to do it to sub-district level, we would like to get to a point where we can actually have the models themselves being in the open, so that they can be evaluated, and people can also make comments on the assumptions that they're making. So at the moment, yes, there's a lot of sharing that's happening with presentations about the models, the predictions that they're having, and all those things. But I do also understand some of the challenges that have come along, because then you put out a model, you put out a prediction, and then it doesn't happen in the way you said it was going to. It was never, as scientists, we understand that, you know, it's the best information we have at the time, right? And we're trying to understand what's actually going on. And then you then get, like, you know, there's some attacks of saying the model was wrong. It's not that it was wrong. There was always, like, you know, an uncertainty band of where, and also things change in what the intervention that we're putting on the ground. So, but we do have to get to a point where we can discuss this amongst ourselves in a good way.
Okay, thank you. We have a question from eThekwini, where they say that economic development in eThekwini would like to get data on the infection rate in the different economic sectors, and whether that kind of data is available. So is there a way to be able to get that?
I'll do a quick one for that one. They can email me, but it basically comes down for us being able to get district and sub-district data from eThekwini or KZN. If we can do that, it can always be recalculated so that they can actually have that. That's, yeah.
Okay, so the next question is about comparison to previous years' disease deaths and hospitalizations, because that might be useful then to model, you know, that might give insights into how we're doing. So is that information being used somewhere?
I think maybe I'd ask Tulio if, like, from a, it would be very interesting from a perspective of a more seasoned researcher in this, like, you know, in academics, to hear his view, yeah, on this one.
Okay, I can answer that. Yeah, the South African Medical Research Council have a whole unit that look at mortality in the country, yeah? And they have been doing that for the past 20 years, yeah. So they are the best source of data for mortality, yeah? And we use some of the graphics to explain. Yeah, South Africa so far is in a fortunate position. We had a negative number of deaths if you compare with the previous years, what's really unusual, yeah. But that was a side effect of the lockdown, eh? And the MRC unit for that is the best source of data. Now that I have the microphone, I have some good suggestions for you, if you allow me. Yeah. One thing that we are quite interested, yeah, it is what's gonna happen after the lockdown, yeah. And what we see, it is what some countries are doing, yeah. They are beginning to curate data for kind of Google Maps, yeah, showing transport, yeah. And especially we would be very interesting to get data on both cell phone public data, but also transportation data to see inter-provincial movement, yeah. We are of course very worried that what's happening in the Western Cape will spread around the country, yeah. And that would be also quite interesting to see, as we have what we call this clustered outbreaks, yeah. As you described very well in the mine, we want to see if that will end up as an amplification event in other areas. So it would be good to see, like, some kind of people movement data from South Africa. And if you guys get a good source that could add to the GitHub, for example, in the country of Francesco in Italy, that was one of the reasons for the disaster, yeah. a few days before the lockdown, they told everyone, and people just moved from the hotspot to all the areas, yeah, and that ended up fueling a countrywide epidemic. Yeah? So that may be quite interesting data. I thought that your idea to replicate of what the German have done on the ICU is a brilliant idea, yeah, and that's also quite important data, yeah. Yeah, of course you can go into modeling. Yeah, we personally are scared to go into modeling because scientists understand modeling, but the general public don't. Yeah, and one also have to be quite careful because at the moment people they see like 100 pieces of data and 99 of them make sense, and then the one that doesn't make sense they start attacking. Yeah, and one have to be always quite careful with that. So just comments on that from you. Thank you.
So a quick one on that. Thanks for the last part. And yes, that's why we stayed away from modeling for such a long time. And now we're actually looking at it as more of a tool for other scientists, not for like, it's not a gotcha thing of like, oh yeah, your model is working, but it's not. And we're not, like, we were trying also not to be saying we chose these perfect variables to go in, but again, it's more on allowing going towards an ensemble. There's kind of a short white paper that's going through the modeling seminars, and then hopefully that will get to a scientific agreement on the way to do that. On the mobility, very great suggestion on there. We have been, maybe just because not enough hours in the day, think of also asking your large organizations like Google and Apple to make available more lower level data, like in the US, on terms of movement, and then that being available nicely in a CSV that people then can use for other modeling. So we just need to finish typing up what our request. It's there. We have a draft. It's not finished on there, and then we'll submit for that. And there are, I know MTN and Vodacom are working on movement data. It's just yes to get to a point where they can make aggregated information available. I think the interprovincial movement is going to be very important, kind of in a way, and making it available in an ethical way. Just like Google and Apple have worked a lot and with their teams, and also Facebook has worked a lot on providing white papers that explain the methodologies and why the choices were made in the same way. And I would expect the same thing from MTN or Vodacom or whatever network if they do start making their data available, so that we can scrutinize the methodology before they make the data available. Because you can't, it's very hard to put the genie back in the bottle once it's out.
Francesco, there are a few more questions, but I think in the interest of time, we should maybe hand over to you to round up.
We have 2-3 minutes. If the question can be answered quickly, we can try to make everybody happy. Yeah.
Yes, of course. So the next question is the issue of the testing backlog, because we know that there is a large testing backlog. So the question was, how do you incorporate this into the modeling and the country by country comparisons? And the next question related to that is there data available on associated illnesses and deaths that are associated with associated illnesses?
Oh, can you repeat the first one?
How do you deal with the testing backlog? I think there is a large testing backlog, and do you incorporate that into the modeling and country by country comparisons?
Okay, so yeah, we don't, because we're not, as I said, like with the modeling, we're providing the model hub, we're not modeling directly, so we don't have anything where we've released predictions or anything like that. So that, at the moment, we're not adjusting for. It's just the raw numbers. The modeling teams then can understand some of these caveats, so they'll adjust given that they also have access to all the testing data that we do have access to in making those adjustments. Sorry, why am I? Just also another point about the MRC. On there, we have asked Tom Moultrie to also try and make the data available for mortality rates in South Africa available in machine readable format for exactly this reason, that you can now check the overall mortality, whether like, you know, the impact of COVID, the impact of lockdown, and where we are. At the moment, it's a graph that's on there. It's great to see that, but then it's something else if then other people need to use the numbers. So we have asked that, and he did say it is coming. So we're waiting kind of for that. Sorry, I'm trying to, yeah, the testing backlog, there's nothing much I think we can do. It is a very different thing. Because then there's questions on the labs, how the labs, and also the thing that's making it harder even now is that we don't even have enough reagent. It's not really the speed of the tests being done anymore. It's just that we don't actually have the material to do the tests.
I wonder whether Tulio would like to quickly comment on the testing, since he's a little bit more clinical than the rest of us.
Yeah, the testing is difficult, Francesco, and is because, can you see, what I think is that even within provinces, they start to try to say, I test more than you, I test more than you, and it's creating a massive backlog. Yeah, and what we worry is that in the end, it's not just the number of tests, but it's the time that take the test to be positive. For example, if you have a week or 9 days in some province that the test result come, and we know that from some clinicians that sign that test, 1 week they're gonna see a surname. That 10 days later they see like 5 or 7 of the same surname, because people is taking so long to get the result that they end up like infecting other. So I think as a country, we have to think quite hard on number of priority categories. Yeah, for example, of course, patients, healthcare workers, but maybe also clustered outbreaks. Yeah, because if we're just gonna do large community screening, what's great, they screening, yeah, but if you're gonna put like 50,000 samples that does not have the throughput to be processed, we're gonna have to really categorize them on things that are likely to transmit more. And it's a difficult question because everyone has suffered with that, yeah. And the media also have been saying like you should test more, but it's not about the number of tests, it's the turnaround time and who you are testing.
Thank you, Tulio, for that comment. And I think now...
Just a quick question.
Yes, please.
Just a quick one. There is data, for the first 100 deaths, there was a question about the individual comorbidities. For the first 100 deaths, that information is available. From the NICD is likely releasing line lists which have this comorbidity information to each of the provinces. It's just that data is not public. So we can't put it in if it's not shared in a public way.
Thank you, Vukosi, for that comment. And I think now we reached our time limit, so it's probably time for me to thank very much Vukosi for his time and for his hard work. Thank you very much. Please keep giving us access to open data, and please let us know what we can do to lobby for open data as well. Then thank you very much to Anban Pillay for facilitating the moderation of the questions, and to Tulio for answering the more clinical and medical aspect of the questions, and for some very interesting comments. Also, thank you for Ilya, who was my backup plan in case my internet connection dies. Yeah, thank you very much. And also thank you to all the people behind the data breakfast that do the advertising, the organizing, and so on and so forth. And of course, thank you to the more than 100 participants that we had this morning. Thank you very much. We will send out today the advert for the talk of next week. So Vukosi, again, thank you very much. Have a great day. And a good day to everybody, and stay safe, and don't do risky things during lockdown level 3. Yeah, thank you very much. Bye.
All right, thank you.